walk through our DNA less invasive surfactant administration protocol, or Lisa. So to get started, I'm going to make sure you have all your equipment ready. So we'll have a little syringe to be able to draw up the surfactant. That's how you'll administer it. You're going to want your NeoView or equivalent laryngoscope and camera, a tape measure of some sort to be able to mark your angiocath. You want your actual angiocath, which is going to be the 16 gauge 5 1/4 inch angiocath, and this is what you'll use to intubate the baby. And then you want to have your CPAP already set up in place, and you'll want a little piece of tape already cut, and that's what we're going to use to mark the angiocath for the depth insertion. So get the baby set up on your CPAP, your NIPPV, aspirate out the stomach so there's no food in there at all, and have someone in charge of swaddling and restraining the baby so that the baby doesn't fight you too much. In terms of medication, we do recommend giving at least atropine, 0.02 mg per kg IV, to help with any kind of bradycardic events. And then strongly consider giving fentanyl, 0.5 mg per kilo, just because it is still a relatively painful procedure using the laryngoscope. So to start, you're going to take your angiocath, take the plastic cover off of it. We are estimating that this baby is about 1 kilo, so we're going to take the angiocath and measure, calculating the weight in kilograms plus 6 centimeters. And this is where you're going to, this is from the tip of the angiocath. So I'm going to mark it at 7 with a piece of tape. I'm going to put the line right there. So this is just going to help us say exactly where we're going to hold it at the top of the lip. Let's see. I should have you do this, Chris. You're probably better at taping things than I am.
This is going to be another set of hands.
Okay. Then you're going to, so that's just now marked at about 7 centimeters. I'm going to take the stylet out of there, the introducer needle. And then you can take the bottom of the angiocath and curve it a little bit, kind of into a hockey stick position, just like you might do with an ET tube to help get you in the right spot. So I'm gonna give that to Chris. You're gonna leave the CPAP on the baby. If it gets in your way while you're intubating, it's okay to kind of push it to the side or something. Ideally, we'll have the baby on it the whole time, but with a real baby, I'm not sure how realistic it'll be. But the goal is to kind of still be providing some positive pressure for the baby throughout the whole procedure. So then you're gonna put your laryngoscope in. So until you see the cords, insert your catheter. So because it's rubber on rubber, it doesn't want to go in very nicely, but it should just go smoothly right through the cords. So you're going to take your laryngoscope out, close the mouth, hold it nice and closed, make sure your tape is right at the top of the lip there, and that should be a pretty good measurement for you. And then just keep the mouth closed, make sure your CPAP is back on where it needs to be, and then your RT can go ahead and instill the surfactant. I would probably recommend some slow pushes, kind of over 30 to 60 seconds or so, depending on the tolerance of the baby. If the baby starts bradying, then you can pause for a second and let them recover. You can have a bag mask ready in case they need some PPV to recover. You might see some pop back into the oropharynx, some of the surfactant, and that's okay. That's to be expected. Don't worry about it. And then once it's done, you can then have them push like 0.2 mLs of air through just to get any that's remaining in the catheter into the lungs. And then you can just pull the catheter out and then let the baby recover. So if you're able to put the baby prone, if not, that's okay. And try not to suction for like 12 hours or so if you can get away with it. We just don't want to suck any of the surfactant out of there. And then you can get a blood gas in 30 to 60 minutes afterwards and repeat a dose in 12 hours if needed. And that should be it.